Dr. Ramputty, can you please tell us about the relevance of health facility autonomy when it comes to Mauritius?
Okay. Let me give you a small background on what we did for the last 3 days while you had this conference on collaborative healthcare for primary care, budgeting, right? We had 3 days of very fruitful discussion about all the aspects of financing in primary care in the African region because it was hosted in Mauritius, so more specifically how Mauritius is dealing about it. In Mauritius, actually, the health services are free across the board from primary to secondary to tertiary care level. All that we have discussed in the last 3 days may appear not relevant to what we have discussed, but it's still the autonomy and control of financing in primary care is very important if you really want to be effective at the service delivery point, right? Mauritius being small does not comply to all the norms that need to be applied in the larger mainland Africa. Yeah? So in mainland Africa, because the services are from regional, subnational, and another national, regional, and so many layers of primary care. Often what we discuss that the fund does not flow smoothly from the central government to the national, subnational, regional level. And the services delivered in the Africa mainland, basically the financial side is relatively poor, I would say that. So there was a need actually to review the whole process of financing primary care because this is the first contact with the population, right? So I suppose if the fund does not flow directly to where it needs to be, the quality of care cannot be improved. We in contrast, we have a different scenario in Mauritius. The flow of fund from everything is centralized. So the flow of fund from the federal government to the Ministry of Health to our subnational is quite fluid. So we actually need to be very cost efficient in what we're doing. So for Mauritius, may not apply all the principles that we discussed, but for mainland Africa, there's absolutely a need to revamp the whole financial procedures and control mechanism, and at the same time providing a flexibility at the source. Because the work are put based on the financials of the primary care basically.
Dr. Ramputty, throughout these 3 days, you've had the opportunity to engage with different countries on the continent, whether it's the Central African Republic, whether it's Uganda, that started reforms in the health sector in 1987, and Uganda has come a long way when it comes to health sector reform, but also countries like Burkina Faso, which was cited as quite an inspiration when it comes to reforming the health sector. By the WHO through Dr. Hélène Barrois. Are there similarities between Mauritius and what you've heard from the different countries represented at our policy dialogue this week?
Yeah. What I gathered from the whole discussion, there's a huge difference or disparity in various countries in Africa. Some have done excellent job adopting this financing of primary care flow of funds, have been very excellent and they have improved. Some countries are learning from others' mistakes. Some countries are trying to implement what others have successfully done it, right? So I think this sharing of knowledge, which was organized by CABRI to share these experiences and knowledge for everybody learning from the whole process was very, very instrumental, right? As I said earlier, for Mauritius, the concept or the situation is absolutely different. It's a small country of 1.2 million population, and the services of primary care is in 1 kilometers to the recipient, to the patient, to the public. So because it's small, we really don't feel it will be cost effective for us to go in that direction. Certainly, once e-health come in, maybe we need to redefine the way we are proceeding, because from there, once we have the data, once we have the input, once we see what's the population size, how people are evolving, certainly we will adopt, and we will always look for CABRI to advise us if there's any need in these areas. Maybe there are some areas where we could do better. Okay, so as far as Mauritius is concerned, the flow of funds is not a problem, but definitely we need to work hard on the quality care, which our countrymen deserve the most.
Thank you so much, Dr. Ramputty.
Thank you.
Thank you.